This is a muscular anatomy review of the wrist and hand with focus on the thenar and hypothenar eminence, as well as the other intrinsic muscles of the hand. Beginning with the thenar eminence, we see four different muscles: the abductor pollicis brevis, the flexor pollicis brevis, the opponens pollicis, and the adductor pollicis muscle. Beginning with the abductor pollicis, this muscle has an origin along the flexor retinaculum, the scaphoid, and the trapezium. It inserts onto the lateral aspect of the base of the proximal phalanx of the thumb and acts to abduct the thumb. It is innervated by the median nerve. Just medial to that is the flexor pollicis brevis muscle. This muscle similarly has an attachment or origin on the scaphoid and trapezium, carpal bones, as well as the flexor retinaculum of the hand. It inserts onto the lateral aspect of the base of the proximal phalanx of the thumb and acts to flex the thumb. It is also innervated by the median nerve. If we remove the flexor and abductor pollicis muscles, sitting deep to them is a small muscle known as the opponens pollicis. This muscle also has a shared origin on the trapezium and scaphoid, as well as the flexor retinaculum, and inserts on the lateral side of the first metacarpal. It acts to oppose the thumb, taking the thumb towards the pinky, or little finger, and is innervated by the median nerve. Lastly, the large muscle of the thenar eminence is the adductor pollicis muscle. The adductor pollicis has two heads, one of which attaches onto the capitate, as well as the base of the third metacarpal. And the distal head originates from the body of the third metacarpal. Both heads insert onto the medial aspects of the proximal phalanx of the thumb, and collectively their action is to adduct the thumb. Looking medially at the hypothenar eminence, we have three primary muscles to discuss: the abductor digiti minimi, the flexor digiti minimi brevis, and the opponens digiti minimi. Beginning with the abductor digiti minimi, this muscle originates on the pisiform carpal bone and inserts on the medial aspect of the base of the proximal phalanx of the fifth finger. Its action is to abduct the fifth digit, and it is innervated by the ulnar nerve. Moving laterally, we see the flexor digiti minimi brevis muscle. This muscle has an origin on the hook of the hamate and inserts onto the medial aspect of the base of the proximal phalanx of the fifth digit. It acts to flex the proximal phalanx of the fifth digit and is innervated by the ulnar nerve. Lastly, similar to the thumb, the fifth finger has an opponens muscle. The opponens digiti minimi originates on the hook of the hamate, similar to the flexor digiti minimi brevis, and inserts on the medial border of the fifth metacarpal, so it does not cross the MCP joint. This muscle opposes the fifth digit, so brings the pinky towards the thumb, and is innervated by the ulnar nerve. Lastly, looking at the intrinsic muscles of the hand, we have three primary muscles: the lumbricals, the dorsal interossei, and the palmar interossei. Beginning with the lumbricals, which are highlighted in white, these muscles originate from the tendons of the flexor digitorum profundus. So they actually do not have a bony origin. And the individual lumbricals attach onto the lateral aspect of the base of the metacarpals for fingers 1, 2, 3, and 4. Collectively, these muscles flex the MCP joint while allowing for extension of the IP joints. So if you think of making a puppet with your hand, we flex the MCP joint while maintaining extension of the IP joints. If we remove the lumbricals, we see two other groups of muscles. Beginning with the palmar interossei muscles, also known as pads, these muscles have an origin along the base of metacarpals 2, 4, and 5, and they insert on either the medial aspect of the base of the proximal phalanx for the second finger, or the lateral aspect of the base of the proximal phalanx for the fourth or fifth finger. Because of their orientation, the palmar interossei act to adduct digits 2, 4, and 5. If we look at the dorsal aspect of the hand, you can more clearly see the dorsal interossei muscles. Notice that we have 4 of these versus 3 palmar interossei muscles. These muscles run from the metacarpals of fingers 2, 3, 4, and 5, and insert onto the base of the proximal phalanxes of 2, 3, and 4. The dorsal interossei muscles act to abduct the fingers, at least fingers 2, 3, and 4. Remember, we have a separate muscle to abduct the thumb as well as the 5th finger. And because the middle finger is the midline of the hand, we have 2 muscles that abduct